We are from the Tech2i company, and our company been assisting CMS in the health insurance marketplace work for more than a decade, and that's why we as many of you have a good experience with working with the challenges, and we see so that how it's difficult for people to get the right information, to know all the options so that are available on the market, and navigating all these ever-changing rules and policies. It's really difficult. So this is one of the main challenges that we were trying to address in this solution. And I would say so that in more detailed bullets, so that we kind of tried to put in this slide, is that the rules are changing from state to state. Besides the differences in rules from state to state, so like we also have different programs. Sometimes people don't know if they're eligible for Medicaid, for CHIP, for private insurance, where they go. So like the websites are different, and so people are just lost in this maze of options, and so that they may not know so like where to go. And another problem that we see is that in my home state, which is Virginia, we have nearly 2 million people that rely on Medicaid and CHIP, and we have. It's estimated so like that so there's only one navigator per 40,000 people. It's just not enough, and it will never be enough. And in 2024, the government is set to spend about 100 millions for the public assistance programs, basically so for the navigators, so that are assisting people, and it will never be enough. And that's why so the question is it possible to build something that will solve this problem, so like, and will make the information available and reliable. And finally, so like if we are using the GenAI to solve this problem, can we trust it? So that's the problem statement, so that we kind of identified. So again, I'll pass it to my colleague Harsh to continue with the next slide.
So let's talk about the research methodology. So our research methodology focused on integrating generative AI into data analytic workflows. And we leveraged large learning models to streamline the processes without needing a deep dive in data science itself. We selected the right tools to build a functional application using LLM APIs. We also addressed LLM limitations, such as hallucinations and outdated data, by implementing a selective input process and using human-machine collaboration. The LLM acted as a search engine, while human experts curated and validated the information. Lastly, we experimented with various LLMs and prompt engineering, optimizing performance for the policy's needs. Our target audience, we kind of would like to focus on low-income families and vulnerable populations, simplifying eligibility assessments for quicker access to Medicaid and CHIP. Administrators can also use AI chatbots to streamline this process, improving efficiency and ensuring accurate information for applicants. And we have a demo here. Hopefully that works in my not greatest voice. There we go. I don't know if the volume is there. Oh. Sorry, this is a technical issue. Yeah, I guess not. anyways, I'll talk over it. So we have an admin side of the application where we kind of have 50 states on the left side, including a federal tab on the left. And then we have a fetch data sources tab on the top right. So in the fetch data sources, when we click that, we get all the links and data sources that are related to that particular state for Medicaid or CHIP. And then we can edit these links, look at these links, and change it accordingly. And this is what the admin would be doing. And then the admin can save these links, create summaries, and these summaries also have prompts that are editable by the admin. And then the summaries can also be changed as per what the admin feels is necessary. And these are experts in the field. And also questions are created using the summaries that we had. And these questions are also editable. And these are the questions that's going to be used to determine eligibility for any of the users that are using our chatbot. There's a federal tab. I kind of missed that. But in the federal tab, we also have any federal guidelines that are relevant in CHIP and Medicaid. And those federal guidelines kind of help the chatbot understand the MAGI and AGI kind of rules. They follow the same pattern of what was being done in the states. Also, in that demo, we showed more for the CHIP, but we also have a button that can go into Medicaid, so we can flip into both programs. And also, we have the chatbot here, and then basically asks a bunch of questions, and then the user will get to know if he or she qualifies for CHIP or Medicaid. From the admin side, another very important aspect to note is that part of the application will not be used on a regular day-to-day basis, but rather for policy changes or during any data that has not been inputted correctly. So that's a barrier that we are creating to make sure that we don't have any false information going to applicants. So for our key findings, AI is powerful, but human oversight is essential to avoid risks like inaccuracies and hallucinations. Just like Tesla's autopilot, where drivers keep their hands on the steering wheel, Gen AI works best with human collaboration and ongoing iterations to ensure safety and accuracy. AI-driven summarization and question generation can simplify access to Medicaid and CHIP benefits, making eligibility assessments easier. Beyond Medicaid, this approach can be applied to other government services and healthcare programs, improving public access and reducing administrative burden and costs.
I would like to also clarify so that so what we call admin is actually a subject matter expert, and the subject matter expert so has the opportunity to review the results before so they are going public. So essentially, so like if I need to ask these questions to determine the eligibility, then the subject matter expert, which is the admin in our case, so can do it beforehand. So like and then after, so this is prepared. So only then, so like this application will, the chatbot, so will actually so like ask these questions. So that's what we call admin. In essence, it's similar to what the other teams so also did. It's the collaboration between the human and the Gen AI. So that's what it is. Next steps. So essentially, so like we have maybe too many bullets here. So but let me just summarize this way. So like we want to make this collaboration between the generative AI and human a practical solution. So we want to make it a really helpful and useful framework that can be applied to different so public policies. And while doing this, we also need to make sure so that the personal data, so privacy is actually so handled the right way. So it should be hardened solution. So like the data should not be leaking. So like and should not be trailblazing traveling too far. So like we also need to make sure so that the results are 100% accurate. So for this, so like we generated automatically, so like the Prolog code, and so like the results were pretty good. And we believe so that the Prolog can be used as a tool for data quality metrics, and also to so basically, so we can use this as a way to test if our results are correct or not. And another thing, so like that we are hoping to achieve is to work with regulators and maybe recommend the most standardized way that is easy to understand for both humans and the LLMs. And this way, so like it will be much easier so for technology side to produce the tools like calculators that will calculate the cost and other aspects of this of the policies. So that's our next steps.